This is another presentation by My Weight World. The skinny on fat. What's left to eat? We will be discussing the role of body fat as well as dietary fat on your health, weight, and risks for many common diseases. Often when we think about weight, we usually think of a number on the scale. Actually, body weight, as it relates to health, is much more than that. Other ways to assess our health includes body mass index, a relationship between your height and weight, and a simple measurement of your waist size. In regards to our eating habits, reducing our health risks are generally enhanced by minimizing foods containing damaging ingredients, such as saturated or solid fats, trans fat, smoked, salted, or charred meats, and highly processed and refined carbohydrate foods. These foods, when eaten on a regular basis, increase our risk factors for diseases such as coronary artery disease, diabetes, cancer, and digestive disorders. On the other hand, choices of certain foods can increase our protection from these diseases. Protective foods to emphasize are usually those which are the least processed, such as whole grains, fruits, and vegetables. Instead of going on a strict diet, a great way to start healthier eating is simply to focus on adding in more servings of these protective foods every day. Body mass index, otherwise commonly referred to as BMI, is often used to identify if one is within a healthful weight range. This method can be useful to a point, but does not take into account body composition. For example, one can be classified as overweight, but have a low body fat percentage and or large amount of lean, healthy muscle, while being above what is considered a healthy weight. On the other hand, someone can be considered normal or even underweight, but have an undesirably high amount of body fat, especially in the abdominal area. As this slide shows, waist measurement is an important part of determining your health risks, since excessive abdominal fat causes metabolic disturbances which can lead to chronic diseases. Generally, the goal for waist measurement are less than 40 inches for men and less than 35 inches for women. Excess abdominal fat has been linked to several types of cancers, including colon, kidney, esophageal, breast, and uterine cancer. Type 2 diabetes, as well as heart disease, stroke, high blood pressure, and joint diseases such as osteoarthritis are also linked to excessive body weight and especially excess abdominal fat. Abdominal fat may be a factor in hormonal imbalances, as well as elevating inflammatory processes throughout the body, leading to these major chronic diseases. In our goals to improve our health, it is important to not only limit total calories and fat to achieve and maintain a healthy weight, but to minimize sources of fats and other foods that may be particularly harmful. Trans fats, such as those found in chips and pastries, fried foods from restaurants, fats in meats and whole milk products, are some of those sources of saturated and trans fats that may harm our heart and blood vessels. Alcoholic beverages may also be harmful by contributing excessive calories to our diet and promoting elevated blood pressure and blood triglyceride levels. Trans fat may be found in many foods, even those that are not so obvious, such as margarines, chips, and snack foods that may have labels indicating no cholesterol. Even though these foods are cholesterol-free, they may be a significant source of saturated and trans fats, which tells your body to make more cholesterol. Animal products are the only sources of cholesterol. Even though you may try to eat the very lean cuts of meat, it is important to realize that cholesterol is found within the muscle fibers of meats, and thus portion control is still essential. Also, limiting whole milk products, cheese, and butter will help minimize these sources of saturated fats in your diet. Foods to encourage for heart health, diabetes control, weight control, and cancer risk reduction include minimally processed foods rich in nutrients. Plant-based foods of all kinds provide protective nutrients and substances which have been shown to reduce our risks of chronic disease. Fiber is especially important, as it keeps our digestive tract strong and healthy. but it preferably should come from whole foods rather than a separate supplement. For the most part, bright and deeply colored plant foods are the most concentrated in nutrients. Nuts and seeds are also filled with heart-protective fats and keep our appetites under control for longer periods than if we were to follow a very low-fat diet. Dairy products and other high-calcium foods may also aid with weight control and protect our bones as well as decrease risk of colon cancer. Fatty fish, such as salmon, is an excellent protein source and also help reduce risk of heart disease and possibly other inflammatory processes in the body. Other protective foods which are practical and easy to enjoy include green and black tea, seasonal fruit, good quality olive oil, remember a little goes a long way, soy products, and beans of all types. Even with great information, sometimes it is hard knowing where to start. Here are some tips to consider to push your diet in the right direction. For example, consider bringing a small box of raisins to work to replace the mid-afternoon candy bar, or using a marinara tomato sauce instead of cheese sauce on your pasta. These little changes, when done consistently, can go a long way towards better health. Keep your pantry stocked with canned beans for quick burritos or as an addition to salads or soups. Have frozen or canned vegetables on hand to add to a frozen meal or to soups, casseroles, or other dishes. At restaurants, it is usually easy to order a side dish of vegetables, but remember to order them prepared without any added fats, such as butter or sauces. At this point, you might very well be able to close your eyes, imagine your usual day, and think of 3 specific ways you can start adding in some additional healthy foods, such as a small cup of 100% juice in the morning, a small bag of nuts for the afternoon snack, or a side salad with your burger instead of fries. As you practice these small changes, you will become better and better at automatically thinking of more ways to improve the quality of your diet each and every day. You may start looking at foods in a slightly different way, and reaching your health and weight goals will be easier than you might have imagined. Here's to healthy eating. This has been another presentation by My Weight World.